Why is LGBTQ affirmation training so important for the entire healthcare team? Before we get started, anytime you see this heart appear, look for a citation in the references. This is our friend Sticky as a baby. Sticky grew. And grew some more. This is Sticky all grown up. Sticky grew up and exists on Earth. Our Earth. A heteronormative Earth. Sticky identifies as part of the LGBTQ community. The LGBTQ community is very diverse, and it is important to understand the term LGBTQ does not fully encompass all aspects of sexual orientation and gender identity. Sticky's Earth holds harmful ideas towards LGBTQ people. Harmful ideas such as you're a sinner, it's just a phase. Girls don't do this, boys don't do that, and you're not welcome here, just to name a few. Sticky's Earth also does harmful actions towards the LGBTQ community. Harmful actions like dead naming, bullying, rejection, being forced to pick male or female, and bathroom policing. Not only that, but Sticky's Earth even has harmful regulations towards the LGBTQ community. Harmful regulations such as not being allowed to play sports, not being allowed to adopt, being denied medical treatment, being denied spousal privileges, and anti-LGBTQ legislation. As of 2019, LGBTQ laws vary widely across the globe. Same-sex marriage is not recognized in more than 85% of countries. Sticky feels the full weight of simply existing on this earth. This cumulative burden is known as minority stress. Being LGBTQ does not cause an increase in negative health outcomes. Rather, carrying the lifelong stress load weighted down by stigma, prejudice, and discrimination does. Minority stress is like living your entire life trying to survive a storm on rough seas. Minority stress leads to increased health disparities and decreased rates of preventative services. LGBTQ youth are particularly vulnerable. They are 4 times more likely than their counterparts to attempt suicide. In the last 12 months, 42% have seriously contemplated suicide. And every 45 seconds, an LGBTQ youth attempts suicide. Remember, these risks are not because of sexual or gender identity, but because of how they are stigmatized by society. Those statistics encompass data collected from all LGBTQ youth. These risks further increase for youth of color and trans and non-binary youth. Wait. We can make it better. But how? This is Hippocrates Nightingale. Hippocrates represents the entire healthcare team, which is anyone who might have patient contact. Healthcare teams are uniquely positioned to improve health outcomes and reduce health disparities. Affirming healthcare teams reduce LGBTQ-related stigmas and improve patient-provider trust. But how do we get there? Hippocrates sought the best ways to reduce LGBTQ healthcare disparities. The literature showed evidence-based best practices for reducing health disparities involves providing affirming care. Both the American Nurses Association and the American Academy for Family Physicians recognize providing affirming care to LGBTQ patients starts with affirmation training. So what is affirmation training anyway? Remember Sticky? Affirmation training starts with the healthcare team understanding the minority stress that Sticky has endured, and how that minority stress increases health disparities. Sticky decides if they want to come out with every individual member of the healthcare team they encounter. This causes many LGBTQ patients like Sticky to avoid seeking healthcare. Affirmation training discusses evidence-based best practices, including using correct names and pronouns, creating inclusive data collection forms, having inclusive literature, understanding health needs, and knowing where to refer patients. Hippocrates implemented affirmation training in his clinical setting, and the outcome was an improvement in healthcare team knowledge, attitude, and behavior. The team was given the option to wear a special name tag with their pronouns and a safe space emblem. Multiple LGBTQ-friendly changes are being implemented at the practice site. With the proper training, we can start to take at least some of the weight of the world off of Sticky and help reduce health disparities.